Dear members of Dental XP, I'm Peter Horvat and this is my first presentation here. The name of my presentation is Importance of VEXAP. It's about a case of a full mouth reconstruction. First, I would like to introduce myself. I'm 30 years old and currently living in Budapest, Hungary. I'm working at a private practice also in Budapest. Previously, I was a clinical doctor at the prosthetic department of Semmelweis University, Budapest, where I also graduated. I mainly specialized in cosmetic dentistry, but also do general dentistry and some small surgeries. For the case what I would like to show you, I use this Nikon's setup. I take all the pictures in RAW format and process them in Nikon's own software. So the case what I would like to show you is about a full mouth reconstruction. More precisely about the upper jaw of the patient. Because of time and financial reasons we decided to make the lower jaw some months later. A 39-year-old woman came to our office. She hasn't got any factor that contraindicated her dental treatment. The main complaint of the patient was her undesired smile. As you can see, there's quite an abrasion she's got on her incisor part of her teeth. That's why her smile line became irregular or inverse. Basically, we wanted to make the smile line parallel to the lower lip. After the general anamnesis, we registered the patient's dental status. Fortunately, there wasn't any inflammation, only some composite fillings with some secondary caries. So we need a treatment plan. I like to do it in two sequences. First, I need a VEXAP. Without a VEXAP, I don't know how much modification is needed for the occlusion and the aesthetics. The VEXAP should be identical to the final result, because all the following steps are based on that. That's why if I need a good title for the presentation, it would be the importance of VEXAP. I need the VEXAP to meet two criteria. First is about aesthetics. The front teeth should be symmetric. They have to be parallel to the bipupillary line. They have to follow the line of the lower lip. And the centrals ratio should be around 75%. Second, the ICP should coincide with centric relation. I use the leaf go method to register centric relation position. I find it reliable and it's easy to do. When we have the VEXAP, we should verify it in real conditions. It means I have to make a mockup. I always do mockups. It's important for the patient to build motivation towards us, and it's important to me to check everything in the mouth. When I have the VEXAP in my hand and the patient approves it, then I'm able to make the final treatment plan. Without a VEXAP, I don't know what will be the less invasive restoration for each of the tools. It decides whether I need a crown or an onlay, for example. For a crown, I can choose a traditional cementation, which takes a lot less time than an adhesive cementation with rubber dam. So with the VEXAP, I can choose how much time should I reserve for the patient for cementation. For our final treatment plan, we choose 8 veneer lays and 6 360-degree veneers for the front teeth. For our case, I choose 8 veneer lays and 6 360-degree veneers for the front teeth. Of course, I could make palatal veneers from composite, but I'm sure that their longevity is not in pair with the ceramic. That's why I chose ceramic veneers with palatal extensions. When the patient approved our treatment plan, we made some preliminary actions. It involved instruction and motivation of oral hygiene, supragingival scalings, and replacing of all the old fillings. My pictures are taken after the fillings replacement. Here is the upper jaw afterwards with the new fillings. And here is the lower jaw, but as I said earlier, we are going to do the restoration of it in September. And here is the upper front teeth before any restoration. When we have done all the previous actions, then we can solely focus on our preparation. It's an irreversible step, so we need all the information for the final shapes and all the focus we can have. When I have to prepare these, I don't want to make crown build-ups or anything else, just simply focusing on the preparations. Consulting with the patient, we decided to make the preparations in one sitting and also the cementation. Preps of 14 teeth took me 5.5 hours with 2 breaks. Here you can see the final preps before the final impressions, and here is the situation after removal of the second cord. We've got some bleeding over here, and I used ferrous sulfate to stop it. And then I took the final impression. I used silicone for the impression. Usually I use one-step technique for smaller cases, but for bigger cases I have more trust in the two-step technique. I was very happy with the final impression, especially because I didn't have to take it again. Then waiting time came. My dental technician needed 2 weeks to make the final restorations. I made temporary for the whole upper arch. I don't like to use temporary cement or anything, just interproximal interlocking which kept it in place. After 2 weeks, as you can see, there was no cracking, only staining. Then I knew that the occlusion we made with the wax up was good. Then I was ready to cement in the final restorations. Some pictures of the final restorations. Here you can see the wax up and the onlays and veneers side by side. My dental technician did a really amazing work. And from the front. So the cementation meant another 6-hour session for the patient and for me as well. I won't lie, it was a really hard work. I prepared myself like it was a sports competition. Since all the restorations were made for adhesive cementation, I had to use rubber dam everywhere. All the restorations were fixed 2 by 2. I begin with one of the lateral quadrants, and when I finished one, then the other lateral quadrant came, and again fixing 2 by 2. And after I finished all the lateral quadrants, then the front region came. As you can see, the hygienic instructions were very helpful for the patient. There isn't any inflammation on the gingiva. Again, absolute isolation with rubber dam. I began the cementation with the centrals, and when I fixed them, then the lateral and the canine came. And also on the other side, fixing 2 by 2. and after 6 hours we finished the cementation. I only made some basic checkups like front and canine guidance and some small adjustments, and called the patient back after 2 weeks. She was very happy with the final result. Here you can see her new smile. We can say that the tissue response is phenomenal. Even the papillae came down after 2 weeks. Here's the picture of the protrusion. We re-established the patient's function. Gingiva really loves ceramic, and I'm very happy with the shapes of the new teeth. And from the sides. And this is the whole upper arch of the patient. And some artistic photos for the end. This is my biggest case yet, which I made it in one sitting, and I'm very happy with the final result and also with the teamwork for my dental technicians and for my patient as well, because we are all needed for the final result to look like this. Finally, I would like to thank Maurice for his motivation towards me and for the whole Dental XP team to allow me to be here today. I also would like to thank Attila Bodragi to build a standard for me how to make proper dental treatments, and for János Gross because I'm always able to ask professional questions from him. Thank you and bye.